I'm Mel Boynton. I'm an orthopedic surgeon at Vermont Orthopaedic Clinic, and I'm the medical director of the clinic as well. I decided on orthopedics probably during an interview to get accepted to medical school, and somebody was asking me about what I really was interested in medicine, and I hadn't thought about it before, but it came out of my mouth that I was interested in quality of life, perhaps over quantity of life. And orthopedics really is a great, great field because it's all about quality of life. It's about allowing people to get back to doing things that they may not otherwise be able to continue to do. And so it's a wonderful job. It's a wonderful thing to do. Oh, you remember lots of good stories when you're lucky enough to be doing orthopedic care and orthopedic surgery. One is a World Cup ski racer that had a severe injury to his knee and was able to return to the World Cup and return to being near the top of the leaderboard as a speed skier. But then there's others that are a logger who tears his shoulder and is able to return to logging after you fix it and can get back to doing things like that. That's very satisfying as well. In fact, just as satisfying. And then a little old lady who falls and breaks her hip and is worried about being stuck in a nursing home, and we're able to get her hip fixed well enough that she can maintain her independence. Lots of good stories. We're really lucky to be doing orthopedics. It's a great, great field. As an orthopedic doctor, we do an awful lot of collaboration. We don't tend to manage common conditions like hypertension or COPD or heart disease, and so we really, really rely on collaborations with our primary care physicians. A lot of medical education is spent on the medical aspects of a patient, and not a lot is spent on musculoskeletal care. So our primary care physicians really rely on our collaboration with them too. So access within our clinic is super important, and so we take collaboration very, very seriously. Being a doctor can be a bit stressful, so when I'm not working, I'm trying to blow off some steam. Oftentimes hiking with my dog, Roca Jack, Chocolate Lab. We get up in the mountains and ski. Really enjoy Killington and Pico. Very fortunate to live here, but if you're going to live in the cold, you better take advantage of it, so we do. Rutland Regional Medical Center is so connected to the community. The hospital is here for acute care needs, but it's also here to promote wellness and promote health throughout the community, and I think it's doing an effective job of that. And if you're ill, we're here to help, but we certainly want to keep you healthy and keep you active too. Having been a physician for 30 years, there's lots of great moments. I have a photograph on the wall in our office of a patient who had a knee replacement, and she was able to go to China and hike on the Great Wall of China after her knee replacement, and she wrote on there, "Thank you," and "One great knee and one great wall." It's kind of neat. I have patients I have a patient who's an artist who made me a beautiful mahogany sculpture that sits in our office. We keep those things in the office as a reminder of the fun work we get to do and how fortunate we are.